Senior cardiac doctor goes without consent of the family and goes and punctures his artery. And we are finding this angiography. I've never found that it takes 4 hours or it takes 5 hours. So after 5 hours, we start getting a bit concerned. So basically what I'm trying to tell you, having facilities is not important. Along with that, you require good hands. You require good people to assess the situation. And you require good doctors. And that we have in our Department of Cardiology in Goa Medical College. Everybody vouches for them. People are so happy with the treatment that you get. And that's why we felt that this treatment should be spread out over the state of Goa. Whether it is a man in Kanpur, or whether it is a man in Sattari, or whether a man in Pedne, or the man in Panjim city itself that requires immediate attention. And this can happen only with the success of this program. I appeal to all of you and members of this team who are going to drive this program to continue to have the same passion. Let's make this a success, and it's very important to take this forward. And I would like to assure all of you that me and Mr. Ashok Kumar will support this initiative and this important program, which is going to be one of its kind and the first in India to be launched. We are really proud of it. That's why I was always telling that we must intimate the government of India also, because there are several things on the Government of India National Health Mission programs that Goa was the first stage to start. Whether it is newborn baby screening, whether it is introduction of pentavalent as a pilot project, and now today the STEMI program. Because we have to show the way. We are a small state where we can make a difference in people's lives. And I think this STEMI program will definitely save more lives and continue our slogan of saving lives, that we constantly say that our mission is saving lives. Every health officer must constantly get upgraded. Every doctor who has taken training should continuously get upgraded on this program. And it's very important for the doctor in his own professional life and for the student also to learn more in order to grow. Today, education, innovation is not going to stop. Unless you have that craving for more and more, then this is not going to, you will never be able to achieve those heights that you want to achieve in your professional life. And I appeal to all of you to support us in taking this initiative forward. And this is something which I am very passionate of. And that's why I've been after Dr. Guru Prasad for a long time, that I want this to be done, I want this. I said, even if there are certain errors also, and you're worried that these errors should not occur, doesn't matter, but you need to start. Ultimately, I gave an ultimatum that 19 December is your cutoff point. Before 19 December, we are going to start this program and we are going to continue our mission of saving lives. And that's how we need to move forward. And I'm confident that every doctor in Goa Medical College will support our initiative, and every doctor in the health department, both the elements and both the pillars of the department, along with GVK MRI, our Director of Health Services, our Dean Goa Medical College, Medical Superintendent team of the Cardiology Department, Dr. Guru Prasad, and all the other doctors present here. And my advisor in chief, like I always call her, she likes to hide behind the smoke screen, who always keeps me on a correct track. Sometimes when I go on get derailed and on some thinking process. But you need somebody like that to guide you. And I think you need somebody to guide you, because sometimes you're pressurized under today's various circumstances. So as a result, I wish to come back on track to try to achieve what you want to achieve. Ultimately, our goal in this type of a portfolio is only to save people's life. Beyond that, we have no other mission, and I'm sure we'll continue to do so. Thank you. Secretary Health, Government of Goa, Mr. Ashok Kumar, the Dean Goa Medical College, Dr. Pradeep Naik, Medical Superintendent, Goa Medical College, Dr. Bandekar, our Director of Health Services, Dr. Darvi, the project in charge and medical director for this innovative program, Dr. Guru Prasad, our senior doctor and a person very close to me from Healthway, who actually now is known more as Healthway, is Dr. Viren Kaukar, the Dean Dental College, Mr. Varun Albukirk. Then we have Dr. Charit from Tricog, Dr. Rajnanda Desai, who always like to sit behind the smoke screen, and Dr. Purti Patkar, who's in Goa in charge of GVK MRI, the members of the cardiology team, Dr. Shirish Borkar and Dr. Manjuna, Dr. Amar, all the other doctors present here, HODs. I always like to insist that, head of departments and the senior residents and junior residents should be present for these type of programs and innovative programs. The only reason is that these experiences that we have gone through and this whole team, and Dr. Kedar, I forgot to mention, Dr. Radha, who's also going to play a role in this innovative program. It's very important that all of us understand is that these type of experiences that were just discussed and also these type of situations that have been mentioned during the presentation is that immediate attention is to be given to a patient suffering from cardiac care. Many of us sitting in the audience must have lost somebody from our family. Some of them must have gone into a situation where we may have not been in a position to, save the heart or the damage to the heart, to reduce the damage to the heart. Let me tell you that this program has not just come. We were thinking of this program for a long time. And I'm so grateful to the Honorable Chief Minister for having set up the Department of Cardiology in the Goa Medical College. It is only through this Department of Cardiology, also Dr. Guru Prasad mentioned that initially it was Victor Apollo that was doing all the angiography and all the cardiac related interventions initially. They were the pioneers in it in the state of Goa. As a result of it, people from Goa didn't have to go outside the state of Goa. Let me also say that today we have got an excellent team of cardiologists in the Goa Medical College. The finest doctors who work day and night at any given time you call them up. With a smile, they answer the call and they are there available for us to take this forward. It is so important that this innovative step, that's what I was talking to Dr. Guru Prasad the other day, that we need to take this step and move forward. It is very important that we all unite and we have all become a part of a team, just like Mr. Ashok Kumar mentioned. The reason being that our mission, which we constantly keep on mentioning, is saving lives. And you can keep on saving lives if you take advantage of different types of new innovations, new technology, and most importantly is what is the practical situation on the ground. Today, if you go to a place like Kankon or you go to a place like Sattari, today you find that in the past, people were not accessible to this type of healthcare. A person gets a cardiac problem, then there was no future for it. Many times people have lost their lives coming to the hospital. I know several people who have come and collapsed in the hospital because there was no that type of facility for the patient to be revived or for the patient to get this type of treatment that we are talking about today. I would also like to mention to you that these type of situations in a minister doesn't function just because he wants to do something new and innovative. It is a team. It is a team of professionals, team of experts, all come together. We all discuss, brainstorm. We have got a fine secretary with us, Mr. Ashok Kumar, who I always tell, the objective is X. We must see how we can achieve this objective and who's been very cooperative on various initiatives of healthcare. Real life situations drive you to drive a policy for the state. And many times when you do this, go through these real life situations, you realize how important healthcare is and accessibility to this type of situations, emergency situations that you can deal with. Cardiac issues in Goa. In order to deal with it, that's why we thought that we must have this type of facility. And I was very happy that TRICOG is partnered us in terms of telemedicine and for us to try to get these ECG analyzed and to give the right type of direction to the doctors. And it is so important because a person in Sattari getting a heart attack, then he can be thrombolized there and then he can go to the closest center for intervention. Intervention either to Healthway or intervention either to Mr. Varun's hospital in Madgaon, because the whole of South Goa, in order to reduce the time, because both the hospitals are recognized under DDSSY, and our Goa Medical College. I must share with you that in the past, we went through several, not real life experiences, but real life experiences. And in my life, I've gone through several experiences that have helped me make several decisions in terms of making healthcare more accessible to the people of the state of Goa. There was a time that in the past, when you got a heart attack, there was no hope. I'm talking about 20 years back. And as a result of which, you had to navigate. If you survived that, then you have crossed the barrier. And in my life also, I've gone through these experiences. And it was none other than the Goa Medical College that was the only hospital in those days that played the role of saving one's life. And Goa Medical College, in my life at least, has played a very important role because I've experienced, I've seen Goa Medical College at that point of time, And I always used to think that how these type of situations can be handled and taken forward. And as a result of which, I constantly I'm craving for new type of technologies, new type of things that can save people's lives. And everybody keeps on talking. I was just recently for a conclave in Delhi, where there were people from right from Carnegie Mellon, right from Harvard to everywhere, all people from different medical schools talking about the new innovations in healthcare and how new innovations can help and influence state policy and how we can save lives and how we can increase the outreach of such programs. And it was an interesting thing, there was somebody from Kerala and there was a Secretary of Health of Kerala. He says, no, Kerala first. Then I told him in my speech, Kerala may be first in X, Y, Z, but Goa is first in all these things that we are doing as a state policy. And I thought that it's a proud moment for us as a small state trying to implement these type of things. And I was share with you that even in my father, when he got a heart attack, I actually drove him to Goa Medical College. And that's how, when you drive a policy, you have to think how you can save and make that difference in somebody else's life. You don't want him to go through the same ordeal that you went through. And that's the reason why I keep on insisting. And I'm very, very serious. That's why I said today, invite the guard president, make him sit on stage. Because along with the guard president, all the senior residents also must be a part of this program. We are striving day in and day out. We are also spending a lot of money in terms of increasing health infrastructure, through health infrastructure and with our visionary Chief Minister, who has been also helping me in getting a lot of funds from Delhi. We are putting up a new super specialty hospital. Super specialty hospital also means jobs for the same doctors who are now senior residents and who are working in the Goa Medical College. And as a result, to create more job opportunities for the students in the state of Goa and our doctors and bring our specialists who are outside the state of Goa back into the state of Goa, we must have that type of state-of-art facility in the area of healthcare. And as a result of it, that's why sometimes I'm a little aggressive in certain things that I do. And luckily and fortunately, with the help and the backing of the Chief Minister, who himself is fighting his own battle, and his own illness, has been very supportive in helping me take these initiatives forward. During my earlier tenure as a health minister and even now as a health minister, an excellent team. Even that time we had initially started discussion with Dr. Guru Prasad. And that's how new things evolve. Today you have a tie-up with Tricop. Today you have a tie-up with some other company that wants to give that type of support system. Dr. Varun's hospital was one of the hospitals when my father's doctor came in from abroad and he did another angioplasty, and next day morning he was back in the assembly as leader of opposition. And let me tell you that healthcare is something that even the richest man, he requires the same help that a poor man requires. If somebody is staying in the remote place of Goa and has all the wealth but doesn't have access to this type of healthcare, then you cannot save his life. And I still remember the instances. That time we had Dr. Theodore and Dr. N.G.K. Sharma, who accompanied me to Sanctum, and we came down. He was head of Department of Medicine. And I've gone through this whole thing. That's why I'm very, very particular that healthcare and health services in the state of Goa must be of a certain level. We must get the best expertise and the best doctors from outside the state of Goa into the state of Goa. There are so many doctors of Goan origin who want to come and contribute to the development of healthcare in the state of Goa. And for that type of facility and that type of model integrated with the private sector is the only workable model in the state of Goa. I'm of the opinion that capacity building was also very important. If we don't have that type of capacities in our own setup, then we must involve the private sector so that we can take them and move forward. Our doctors in the health services also are doing great jobs. They are doing excellent service. Whatever limited facilities that they have got, they are trying to utilize it to give best healthcare to the people in the state of Goa. And I am proud of all the doctors who are working here in Goa Medical College. But I also want that type of seriousness should come even in the senior resident. That's why I request the guard president to ensure that you all also should take that type of interest in the new schemes and new innovations that the state government is taking forward. For me, healthcare is become more of a passion-driven subject. And also to see that we try to bring in new innovations, try to see that we bring in more facilities to save the lives of people in the state of Goa. Like Mr. Ashok Kumar mentioned on the NCT platform, we are working on the diabetic care program of insulin. Apart from that, we've got newborn baby screening. Apart from that, just now I just spoke that we are trying under a CSR program to bring iBreast, a company, through a CSR funding program of our famous cricketer Yuvraj Singh. so that we can screen about more than 1 lakh, lakh and a half, 2 lakh women for breast cancer pre-screening in the state of Goa. So this is how you need to move forward. I am grateful to Dr. Guru Prasad and the whole team because it's a team effort. And all of you together, I'm sure you will be able to save more lives. I do not want the situation that I went under. That time there was no GVK, AMRI, there was no ambulance. There was only Dr. NGK Sharma who I had to pick him up from his house. Most of the doctors here must be knowing who Dr. NGK Sharma is. Put him in my car, take him to Sanklin. There we understood that my father had a heart attack and brought him to Panjim. Then here he was under the care of Dr. Theodore. And that's when I realized how helpless a person can get. As a result, it's a suggestion to all the senior residents and all the doctors and HODs is be passion driven. We are here to see that we work to provide relief to the people of the state of Goa and to take care of the people of the state of Goa. Power is not something that is to be enjoyed. Power has to be used to drive your passion and take it forward and see that you become of use to the poor man and the common man who cannot access this healthcare. And as a result of which, I think that we must be more innovative and utilize technology in that particular way. And in that way also, you can find there are a lot of companies that want to come and tie up with you. They want to shake hands with you to see that you can improve your policy on healthcare and take things forward. And when I say this, I also appeal to all the students, the doctors, the HODs, is be more vocal. Say what are the problems that you have, what are the situations that you undergo. I know the situation, sometimes money is required, sometimes several things are required, but then we have limited in that particular thing, as a result of which we function within a particular framework, as a result of which today the model of public-private partnership is gaining more and more importance in driving healthcare and providing the best health services in the state of Goa. There is Dr. Ponraj sitting. He requires the best ward that is required. He operates calling in the middle of the night. I think one day he forgot he was exhausted, so he was speaking in his native language. So I said, did I call up the wrong number? I said, then I stopped the doctor. I called him back because he's also a person who's so much dedicated to his profession. Any given time you call him up, he never says no to go to handle a patient. They have got a neuro navigator, more latest type of equipment is required, but everything requires money and funds. All I can say today is to thank the team headed by Dr. Guru Prasad, our Dean of Goa Medical College, Director of Health Services. All of you are very critical elements of the healthcare sector. And it's very important, GVK MRI, that's also a major partner in this because all has to be integrated. All the medical superintendents present here, Dr. Rupa, who's silent, she's sitting there, who's looking after the NCD program of the DHS. Each one is playing his own role on how to take things forward. Dr. Anupama joined us. Now I am confident that the cancer-related issues also can be resolved and we'll move on a war footing in taking things forward. And it's very important that we all in Goa Medical College and the health services and all our integrated services work as a team. It is very important to do so and very important for us to be passion driven. And that's why all of you must be finding that sometimes I'm very aggressive on a particular front. It's only because of my real life experience that I've undergone. It's not whether it is a neuro rehab center where I one fine day decided to change that guest house into a neuro rehab center. That's all because of what I have gone through and what is the situation in this state, type of cases that you see on a day-to-day basis. And then when during my own lifespan, then I realized I'm meeting a lot of Goan people in these different hospitals. And not only that, we have got the finest team of cardiologists sitting down here. My father has undergone various experiences in I think his heart is only surviving because of the blessings of the people.